Looking at figure 1.9 out of your dissection guide, I want to show you a couple of muscles here and their significance. Two muscles that the dog didn't have. We've got an omohyoideus muscle. Omohyoideus is number 2. Cutaneous coli is number 6. These are two muscles that we did not have in the dog. Now on this cross section, what we have here, I'll color in the external jugular vein in blue. Here's your common carotid in red right there. We will once again have a jugular furrow formed by the brachiocephalicus. It's going to be this chunk right in here, and the sternocephalicus right there. One thing that you will notice about the brachiocephalicus, put a BC right there, is the omotransversaris, let's put OT, omotransversaris and brachiocephalicus will be fused into one almost indiscernible structure. You can't tell one part from another. So I will always refer to this in lab as the fused omotransversaris brachiocephalicus right there. But this jugular furrow will be between the brachiocephalicus part of that combined structure and our sternocephalicus down here. So that little dip in the neck is that depression right here, and in it you find the external jugular vein. But in the horse, we have another muscle right here in the caudal aspect of the cervical region. And it's probably not going to show on here, but this is a cross section of C6. The horse has 7 cervical vertebrae, so we're at the caudal end of the cervical region. There's a muscle right here, and this is your cutaneous coli. And it will cover the external jugular vein in the caudal aspect of that jugular furrow. So if you want to insert a needle into the jugular vein, you don't want to be in the caudal aspect of that neck. Come about halfway up, and this muscle here, it starts off on the sternum and will flip out to the lateral side and will end up disappearing, and your external jugular vein will then be under the skin in this jugular furrow. So really far down the neck towards the sternum, you're going to have this muscle in the way of venipuncture of your external jugular vein. That is the significance of that muscle. When you look at pictures in your dissection guide, there's one in here that shows it from the front, and you can see this wispy little muscle, one coming off right there and one coming off the other side over here. So they're covering up that external jugular vein and your jugular furrow in the caudal aspect of that cervical region. The other muscle, omohyoideus, it is sitting right here. It's running from the shoulder, omo, up to the hyoid apparatus, hyoideus, so omohyoideus. So it comes off the shoulder region and is located here in cross section through this region of the animal at the level C6. As you come up the neck, this muscle will slide over into position so it can attach the hyoid bones that will be around the larynx. And so the larynx will be at the front of our trachea right here. So this muscle is going to slide over this direction to attach to those cartilages. In doing so, that muscle, it starts off here, and as it creeps over, it comes between your common carotid and the external jugular vein, and will separate them in that cranial half of the neck. So in theory, they say that when you do venipuncture in the jugular vein, about halfway up the neck, you'll be beyond the cutaneous coli muscle, so that won't be in your way, which is correct. And then when you're in that position trying to access your external jugular vein, that you have this muscle in between the vein and the artery to protect that artery from your needle. Well, truth be told, this is a very thin muscle, and the tip of a needle is just as sharp as a scalpel blade. So if you're at the wrong angle, you will run past or through that external jugular vein, through that muscle, right on into that artery, and you will get a massive hematoma forming when you puncture into that thing, and you certainly don't want to be injecting into that artery. So this muscle, it's not like a deflector shield in Star Wars to where your needle comes in, it's like ping and bounces off like this and saves you. You're going to run right through that thing, right into the artery, so don't count on that to protect you. It does keep those things slightly farther apart, but again, it's the angle of your needle and the palpation and visualization of the fluid wave through that external jugular vein that you'll learn about in your PD class that will keep you from hitting that common carotid artery with any regularity. Sooner or later, it's probably going to happen, but in best practice is to keep that from happening. So there are two new muscles and their significance. Okay, back to the axial skeleton. You'll remember the dog, 7 cervical vertebra, 13 thoracic, L7, S3, and we did have caudal vertebra there, but we're not going to worry about that number. In the horse, we have C7, T18, L6, and S5, and there will be caudal vertebra. Now in the horse, 18 thoracic vertebra, which means we will have 18 rib pairs. 6 lumbar vertebra, one fewer than the dog, but overall they've got more vertebra total. In the sacrum, 5 bones will form that one fused structure. So they will fuse in the horse just like they did in the dog. I do want to say that the first caudal vertebra will fuse to the back of the sacrum. So the first movable joint caudal to the sacrum is between CD1 and CD2, between the first two caudal vertebra of the tail. And so that space, when you start cranking that tail up and feeling for that first movable articulation, you're in this space right here, and they will use that space for low epidural injection sites. So you will actually be going between those two vertebrae there. First movable joint past the sacrum. And that brings us to the cow. Cow, once again, C7. 13 thoracic vertebra like the dog had. 6 lumbar vertebra like the horse has. And then again, 5 sacral vertebra fused into one structure that we call the sacrum. And of course we have caudal vertebra back there again. So those are the vertebral formulas for the large animal. Now with the vertebral column of the horse, we talked about the 4 long ligaments and 3 short ligaments in the dog already. The horse will have those same structures plus other ligaments of the axial skeleton that we did not even talk about in the dog. I'm just going to focus on one of them here primarily, and I'm only going to ask you about the ones that I talk about. So if I don't talk about the dorsal ventral longitudinal, which I won't, I'm not going to ask you about that, but do understand that they still have these structures. So now in the horse, let's start off with some bursa. Now in the horse, we have a cranial nuchal bursa sits there, and a caudal nuchal bursa will sit right there. So cranial nuchal bursa and a caudal nuchal bursa. Cranial nuchal bursa sits on top of the atlas. Caudal nuchal bursa sits on top of the axis. And we will also have a supraspinous bursa and it sits on top of T2 to 3, about T2 to 3. So if we look at our picture here, see 1, 2, 3, 4, 5, 6, 7, T1, 2, 3. Supraspinous bursa is going to be sitting right in there. What this is doing, these bursa, they are supporting the nuchal ligament. So the nuchal ligament in the horse it has a funicular part, so it's like a strap, and it has a laminar part, which is a sheet. And really there are times two, there are two of these things, and this will all kind of fuse into one structure, but these are formed bilaterally. If you'd looked really close on the dog, that nuchal ligament actually had two little funicular pieces to it, fused pretty tightly together. A lot easier to see the differentiation between the right and left sides in the horse. Nuchal ligament in the dog ran from the spine of the axis back to T1, and then the supraspinous ligament started from there. The nuchal ligament in the horse will actually start on the occipital bone and run down to T3. So starts farther forward, ends farther caudal. These bursa are protecting it as it's running along that length. That is the funicular part. The laminar part is going to be coming off of about C2 to 5, that's the bulk of it, up here to T3. So from 2, 3, 4, and 5, you're going to see all these different sheets in here coming up. It's not one nice flat surface like a piece of glass. It's a bunch of overlapping little fascicles, and they form this big wide sheet. And so it will all be yellow like it was in the dog, and this will be rather remarkable when you see it. We'll cut some muscles down and pull it aside so it will show. So we have this gigantic rubber band, essentially, that's in this picture here in a resting position. So when that horse drops its head down to eat grass or get a drink of water, that band will stretch. So as the muscles are lifting that horse's head back up, the recoil of that rubber band helps lift all this mass back up into a, I guess you want to call it a vertical position. So this is helping the horse and the cow, and especially those cattle with extremely large horns, all that weight, get this back up into an upright position. So that's what the nuchal ligament will be, how it will be arranged, and what it is actually used for there. Dog didn't need it as much as large animal does. Then we've got something else called a dorsoscapular ligament. I'm not going to tell you about the supraspinous, but supraspinous would take over from here and come on back just like it did in the dog. I did mention that, but I'm not going to ask you about it. We're going to focus on nuchal ligament. There's something else called a dorsoscapular ligament. And the dissection guide will show you this, a couple of cross sections of it, and one type of 3D type drawing of it, and it's really kind of hard to get a grasp on, but I'll show you where it is when we take the front legs off the horse. This is coming off of thoracolumbar fascia. That fascia stuff I don't like talking about. And it runs over to, so from the thoracolumbar fascia to the medial side of the scapula. This is elastic tissue, so it'll be yellow. And what happens is, if you remember seeing the serratus ventralis on the dog, and it had several pieces like it had been serrated and cut with a knife, and that's what it looked like on your dog right there. Well, what you would have is in between all those pieces of muscle and this horse, we are going to have a little strip of elastic tissue like so. And we're going to see the interdigitation right there. It will be yellow, and sometimes it recoils back in, so we'll spread the muscle aside to look for it and pull it back out. But we will be looking for this pattern usually on the back of the scapula and not down on the body like we did on the dog. Because when we take this front leg off the horse, we're going to cut as close to the body as we can rather than peeling this off of the scapula. So dorsoscapular ligament, extra attachment for that front leg, because remember, this serratus ventralis muscle is the muscle that's holding the animal up between its front legs. Horse has a lot of weight be held up by that muscle between those front legs. So we have some stretchy ligamentous tissue there that's got a little bit of bounce to it to help strengthen that structure, that muscle, to keep this horse, his trunk between his two front limbs. So dorsoscapular ligament, we will see the cut pieces of it down here. There are its attachments.